So for the definition of an ideal DPI is a DPI that fulfills a lot of characteristics, but probably the most important is the ease of use of the device. Ease of use means that usability by the patient is very easy. For example, a DPI with very few operation steps is considered a very easy of use DPI. But easy of use is not the only feature to be considered when choosing the most appropriate inhalation device for each patient. For example, to have a dose counter, or better, an inhalation counter is a very good characteristic because it reassures the patient about the inhalation and what the patient inhales. While usability or ease of use of a DPI is the most important characteristic, but it is not the only one characteristic. It is not the sole characteristic to be considered when choosing the right inhaler for the right patient. For example, effectiveness. So the capability of a device to achieve good lung deposition with low oropharyngeal deposition is also very important. Efficiency. So the possibility to quick release the drug immediately is another important characteristic. And I think that also easy to learn for the patient and easy to teach for the doctors is much important because reduce the time for teaching and the time for learning. So unfortunately, presently the adherence of asthma patients to inhaled medication is very low. Approximately 40% of patients are not adhering to their prescribed medication. But to have an easy-to-use patient satisfaction and preference with a particular DPI may potentially increase adherence of patients to the prescribed treatment. So the possibility also to have a DPI delivering small particle aerosols is a good point of start because an extra fine formulation that is small particle aerosols so that particles of a medium mass aerodynamic diameter less than 2 micron. With this particle, the deposition is uniform throughout the airways, particularly at the peripheral level. This may increase the asthma control potentially, and then the adherence to treatment for the patient. So there are a lot of characteristics of a near-perfect DPIs that may potentially increase adherence of asthma patients.